Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OB-GYN. Let's get polished.
Okay, we are seeing one of the biggest changes in modern health and aesthetics. It is giant, it is huge. It's bigger than Botox. Can you imagine that? It's bigger than fillers. It's bigger than cosmetic surgery. It's not even social media. And we know social media is big, right? It is GLP-1 medications, the crowd, the results, and the after effects. It came in a surge, and everyone and their grandmother got on GLP-1. And there were so many in the market, and they got results, but it also came with problems. And now we have this huge post-usage problem. This episode is very exciting. I mean, the GLP-1s, just to throw a name out there, you have Ozempic, you have Mounjaro, you have Wegovy, you have Zepbound, you have tirzepatide, you have the newer. Oh my gosh, there's so many of them out there. Which one are you on if you're taking any? So listen up, grab a friend, and let's get into this particular episode because it's so exciting. For the first time in modern history, we have a product that has made millions of America lose weight. I'm talking about significant weight. Some people are losing 20 pounds, 50 pounds, 60 pounds, 100 pounds. I've had patients that have lost 200 pounds. Yes, that much. And you know what? While all the headline is celebrating the weight loss, while the headline is promoting America is getting skinny, very few people are talking about this. They're talking about what comes next after the fat is gone. And this is where I am having this conversation in my office with patients, right? Because the reality is that when you lose all that weight, you are looking skinnier, but is that healthy? Looking skinny and looking healthy are completely two different things. They're not the same. All right. And many people are reaching their goal only to discover some things are waiting for them on the other end. Excessive loose skin, deflated breasts, deflated butt, muscle wasting, you name it, abdominal skin hanging, inner thighs hanging, the pannas hanging, the back hanging, the back bra row, you name it, a facial volume gone. They even look like they're older. And that's not what we want, right? You want to lose the weight, but you don't want to look older. You want to look yourself. And all of this is something that we're not talking about enough. And I've seen countless patients here in the office about this, and I am taking care of them. So I thought this episode, we are going to discuss what I call the new skinny America. Don't you like that title? The new skinny America. Yeah. And we're going to talk about why GLP-1 is changing the game, how it's changing the face of beauty, the body beauty as well, the rise of Ozempic bodies, because we're talking about Ozempic Face. And I did an episode on this before, but now I'm going to focus on this Ozempic body. I'm also going to talk about what happens and also what can be done to fix it naturally, because obviously you want to maintain your natural look, your natural results. So I'm going to talk into that. I'm going to dive into surgical repair and non-surgical repair, and also how to lose weight without softening this appearance defect. So there's a very intelligent, thoughtful way of losing weight with GLP-1 and not losing yourself. All right. I have several parts in this podcast today. So I'm going to break it up into parts because it's so exciting. I really wanted to give each section its own attention. So the first part is America is undergoing a massive transformation, literally and figuratively. Let's start with a bigger picture. Okay. For decades, America struggled with obesity. Childhood obesity is a thing. Obesity climbed like no tomorrow. Metabolic disease climbed as well. Heart disease climb as well. And then guess what? GLP-1 arrives in the market and they start taking care of those problems. And so we are seeing decline in diabetes and sugars, well controlled, weight loss. Well, the truth is that this medication do more than just make you lose weight. They have some effect. And some of the effects of these medicines are hunger signals. So it decreases that, it decreases your satiety, it decreases your food reward pathway system. It improves insulin regulation. It also helps your metabolic health. There's a lot of great things with the GLP-1 out there. And for this reason, many patients have found it very life-changing. I see a lot of my patients that are happy with it and they've gotten the results they have dreamt of, the body they have dreamt of. But the goal is to do it intelligently and healthy, right? So as a result of GLP-1, we're seeing improved sugars for patients, which is fantastic. We're seeing lower inflammation. We are also seeing decreased cardiovascular risk. As we know, heart disease is the #1 cause of death for women. We're seeing that decrease a lot. We're seeing patients moving better, better mobility. They are moving their body because they don't have to carry all that weight around. And they just have a better quality of life. Who doesn't want a better quality of life? And GLP-1 is the answer. It has been the answer for many, many, many patients. And so therefore, it is truly a trend and is truly a revolutionary trend. And it might be here for a very long time. So this is, it's not only a weight loss trend, it's actually a lifestyle trend, because when clients get the results they want, they tend to incorporate lifestyle changes to hold on to it. So that's an upside with all of this, right? The public is aware. We have a public health revolution, and for every revolution comes new challenges. And this is the other part of GLP-1 that I'm going to talk about. And part 2 is why weight loss creates loose skin. Why is that? The natural thought process is that if I lose all this weight, I'm just going to be skinnier and my skin will be fine, because that's what you want and that's what you're anticipating. Well, the truth is that if you lose weight, it doesn't mean that the skin will necessarily shrink back. Not everyone gets to have a snapback. And there are reasons for that. And the reasons is often not, I want you to think of it like a balloon, right? If you go to a store, you buy a fresh balloon, it looks nice and taut and just fantastic. Imagine if you pump air or water into this balloon and deflate it to maximum, and then you deflate it, and then you inflate it again and you deflate it, and you do this multiple times. And this is for someone that's having weight gain, weight loss, or pregnancy, multiple pregnancy. Or let's just say you gain weight or you fill up this balloon one time and it stays like that for a very, 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 very long time. Guess what's going to happen to the integrity of that balloon? It's going to loosen. It's not going to have the same strength that it did prior to inflation. That's what has happened to the body and the skin. So if you gain all this weight and you stay heavy for a very long time, the skin quality is going to be affected. So when you take your GLP-1, guess what happens to your skin? It doesn't snap back. And that's really truly the problem. So you're more likely to have stretching or stretch marks. You're more likely to have your collagen damage when you have this weight gain. And also your elastin breakdown is just basically gone. All of that will be a factor that contributes to your snapback. There are other factors that will affect your skin recoil as you're on GLP-1. Your age, obviously losing weight in your 20s as opposed to 60s, your skin is going to snap back and look differently. Also, genetic matters. If you're just in a better genetic pool, you are an advantage. And there's nothing that can be said about that. You are an advantage. So your gene matters. Sun exposure. So for those of us or those patients that are in the sun a lot and not protecting the sun, and depending on your skin quality and your skin health, that can affect you as well, whether you're able to snap back or not. Smoking, that's another thing that affects your skin quality in menopause. Snapping back in your menopausal year as opposed to your 20s, completely different results. So the main thing is that you have all this fat disappear when you're taking GLP-1, but then you have all this skin that remains. And guess what? The skin is everywhere. It's just not on certain area, and you don't know which area of your body is going to have that loose skin. You may find that one part of your body, it's better as snapping back compared to another part. So when you look at the face after this massive weight loss, you can have hollow cheeks, your jowls will hang. Also, your neck muscles is weak, and so you have skin elasticity on your neck, and also your chin and your jowl areas, as I mentioned. Your arms, you're going to have this bat wings. It happens to a lot of patients. Your breast, oh my gosh, your breast is one of those things that women are so surprised when they take GLP-1. They lose weight and so does the breast tissue. So it becomes saggier, it becomes volume depleted, and it also becomes just excess skin. And it's a problem. So women also want to have this breast lifted back up and all that excess skin removed. Then let's talk about your abdomen. This is a common one. You lose all this weight, but you have this panels of skin still present because the skin is just hanging. It increases your fold, the creases, and then in your thighs. I see this a lot with patients who have skinnier thighs, but now you have all that inner thigh skin that's just hanging, or the lateral thigh skin that's hanging as well. And that carries on to your buttocks. And because you've lost weight, you do lose muscle. You also lose muscle in your buttocks. So you have this sagging butt with excess skin that's there and is deflated. So patients are often thrilled to have this weight loss on their scale, but they're not thinking about the entire body composition, which is something that when you decide to get on GLP-1, you have to, one, know about this effect, two, have a plan to fix this effect, then three, start your GLP-1s. You need to have a comprehensive approach in taking GLP-1 to get the results you want. Now, part 3 of this podcast is what I wanted to focus on is basically the hidden problem that no one is talking about. I feel like I'm one of the few surgeons out there that's talking about this loudly and frequently because I see a lot of it. I have been fortunate to operate on thousands of patients doing body lifting, skin reduction procedures post GLP-1. And you know what? This is very, very important because not all weight loss is good weight loss. You have to think about why you want to lose the weight and what is your target area and what is your target goal. Because when patients lose weight rapidly, that's a key word, rapidly, they don't only lose fat, they lose muscle. So having a very controlled way of losing your weight is very important, okay? And this lean muscle mass that you lose, it's important because I've mentioned this before on my other podcast episodes. You can go back and listen to it. Muscle is key. Muscle helps with so much. It helps with your strength, your mobility, your longevity, your metabolism, and your aging. So we need muscle and we don't want to lose it when we're on GLP-1. So as often as I say in my practice is that, fat makes you bigger, okay? But muscle makes you younger. So in my opinion, it's always good to look younger. So we want to hang on to our muscle. The good goal is never just to how much weight can I lose? I don't think that's how you should approach your GLP-1 journey or thinking about it. Your goal should be how much fat can I lose while preserving my muscle? So it's a very thoughtful, comprehensive approach to GLP-1 therapy. So with that said, I wanted to mention something that I think that a lot of patients are not thinking about, all right? Your diet, your nutrition matters. So focusing on reducing inflammation, inflammatory diet is just as important as taking your GLP-1. Focusing on things that reduce your cardiovascular risk, like exercise, movement, along with your GLP-1 therapy is recommended. So all of that is going to give you a better quality of life and gives you just a better way of moving yourself. Now we're not talking about weight loss. We're actually doing more than weight loss. We are doing so much that is, how should I say? You are looking at your life in a better way so that your quality of life is improved. Now, I did an episode before on Ozempic Face. There's more to it. There's Ozempic body. There's Ozempic aging. And I want to talk about all three, the Ozempic face, body, and aging. What happens to it? Now, Ozempic is the one catching stray in this conversation, but Ozempic is one of many GLP-1s. So I want you to just think of it as all GLP-1. It's just, I guess, with semaglutide / aka Ozempic was kind of the first in that line to come out with this big surge. It catches the stray, kind of like Botox and neuromuscular and neurotoxins, right? I mean, you have other players in the market like Dysport and, but we keep referring to Botox. So Sorry about Ozempic, but not sorry. You've heard the term Ozempic Face. As I mentioned earlier in this podcast, is all the loss that comes with it. But what does that actually mean? Okay. Rapid weight loss can remove facial fat. One of the hallmark of being youthful is facial fat. Do me a favor, pull up your pictures in your teenage years, your 20s and 30s. You're going to see how much fat you had in your face. And, you always joke and say the baby fat, but truly that was that youthful fat that you have. And when you lose weight, you want to preserve that. Unfortunately, with this rapid weight loss, you're going to lose facial fat and you get this Ozempic face, which basically means that you have your temples are hollow, your cheeks are flattened, your skin droops, and the wrinkles become more noticeable and evident. And patients oftentimes look older as opposed to healthier. And we also see Ozempic breast. Same thing, Ozempic breast, deflation, sagging of skin, loss of volume. Ozempic butt. I've mentioned it before. Ozempic arms, Ozempic thighs. Basically, there's Ozempic body, which is the same thing in every area. And the common theme is just weight volume depletion. So when you are on this GLP-1s, you are going to lose volume. You're losing weight, and weight or fat takes up space, and that's volume. So when that's all gone, you're left with skin. And the skin excess is not going anywhere. And we have to do something about it. How do we take care of this post Ozempic face, body, breast, butt, arms, thighs that happened? And, not all treatment are equal. And this is where you can end up, I caution you, spending so much money in so many different places to get results, promise results, and not getting the results you need. So I'm going to break it down into what I call 3 different categories and how to pursue treatment if you're in one of those 3 categories, right? Or I should say levels. The first level is what I call mild laxity. So you've lost all this weight, you have all this redundant skin, but it's not a lot. You could potentially do nothing and be okay, but you kind of feel like, well, I didn't have that before. I want to do something about it. This is the category for you. I call it the level 1, mild laxity. So the treatment options are very straightforward. You can use radiofrequency device. You can also go with microneedling radiofrequency. You can do skin tightening technologies and collagen stimulation. So this is very straightforward. It helps improve skin. It helps with quality of the skin. And again, it's mild laxity level 1. If you're a level 2 candidate, level 1 treatment is not going to work for you. So who's a level 2 treatment? This is where you have moderate laxity. And at this junction, you need to have a combination of therapy as your option. So all those treatments in level 1, you take them and you partner with some of the treatments I'm going to mention here in level 2, which is more energy device that are targeted and specific, your biostimulators to help boost your body produce collagen. You can incorporate it with treatment level 1, and then strategic body contouring. So it could be something where you have contour done to the area proximate to the problem, and that will improve the problem. And it's very, very important to have this consultation visit with your surgeon and have your expectations met. And this happened during the consultation room, where you have in-depth discussion about where you are and where you would like to be, and realistically what can be done. And choose the option that is going to give you a satisfaction and meet your expectation. Level 3 treatment. Now, this is for the patient that has severe excessive skin. I've mentioned earlier, some patients have lost 100 pounds, 80 pounds, or even more, and their skin just didn't snap back. So they have all this redundant layers of skin and stretched skin that needs to be removed. So in this level, we're thinking surgery, because there's no substitute, no amount of cream, no amount of laser, no amount of technology is going to fix this problem. We just need to cut the skin off. And this is where it's very important as a patient to accept this, because there's sometimes you don't want surgery because of the scar and the post effect of surgery, but you want the results So you kind of have to pick and choose, understanding that I may need surgery and it's going to make me happy, but it may come with a longer scar. Balancing that thought process is important. And the surgical options are for your arms, arm lift; for your inner thigh, a thigh lift; for your abdomen, do a tummy tuck. For your back, your lower back, you can do a back lift or upper back lift. So basically the skin is going to be cut one way or another. For your face and neck, there's rejuvenation, whether it's face lift, neck lift, or using a combination of surgical device that gives you surgical like results, but without the scar and tissue that exists in the face. So the whole idea is to find the right patient, the right solution to get the right results. And that conversation happens during the consultation visit. And therefore, you will not be left feeling like, gosh, I didn't get the best of what I was looking for. Now, the sixth part of this podcast is the rise of post GLP-1 patients. The new skinny America is actually a thing. When I thought about this episode and I called it the new skinny America, it was truly because the patients that I've seen or people that I know outside of work that have used GLP-1 and they have lost drastic weight. I mean, they are small from like a size 18 down to a size 6. That is impressive. And I believe that we're entering a new era of aesthetics. And for years, cosmetic surgery has focused on making patients smaller. But guess what? These patients are already coming smaller. So the focus is different. It's no longer, hey, let's make you smaller. It's more like, how can we transform you, given that you've already started the transformation journey? And so the cost of, or I should say, the post GLP-1 patient is the fastest growing clientele in cosmetic surgery and medicine. And because so many people are on it, the ones that openly admit it, and then the ones that do it privately or in the closet, however you want to move in that space. Okay. These patients have already done the hard work. They've committed themselves to taking this medication. They committed themselves to lose all this weight. And now they have this new onset of problem that they potentially didn't think about, or maybe thought about it, but did not appreciate how it was going to make them feel when they're in it. So now that they're post GLP-1 body, it's revealing to them, they feel some kind of way and they want to have it done. They want to have something done to fix it. So it's a very difficult conversation that we used to have in cosmetic surgery about weight loss and management and body contouring, because we're not weight loss surgeon. We're body contouring, body transformation surgeon. A bariatric surgeon was the one that dealt with weight loss. Now, these patients are coming after bariatric surgery or after GLP-1. And so it's making the conversation change in our end. In my end, the conversation is no longer, help me lose weight, because I am not a weight loss doctor or physician. It's more of like, help me finish the journey. The journey I started with GLP-1, and I have this new post body, and I need to get to the end of that journey. And this is where you come in handy. So it's very exciting. It is an exciting time to see what's happening with the revolutionary trend of GLP-1. I say revolutionary because it's not your standard trend, right? It's actually changing America. For good or bad, it is changing America. So this new skinny America is here to stay. It's not going anywhere. And I believe this movement is bigger than just weight loss. More and more people are trying to reclaim their health. They're trying to reclaim their wellness. They are more about longevity, improving their quality of life. It's just, more people are awake. They want to reduce their lifetime risk of having a disease or other element. So it's a great thing. And that's why I think it's here to stay. And understanding this transformation doesn't mean that, we are ignoring other aspects of growth. It just means that we're incorporating into the journey, and chasing the scales is no longer the goal. It's chasing a totality of everything. Yes, the scale, but also the muscle, the skin, and the lifestyle. So I think it's exciting. I really like it. And weight loss is the beginning of the transformation, and patients have already started at home. So the next chapter is preserving muscle, protecting your metabolism, maintaining your confidence, addressing loose skin, and aging well. All of that is very important. As a cosmetic surgeon and also women's health gynecologic surgeon, I see this every day in my practice. I have been fortunate to do thousands and hundreds of body excision procedure. I've used devices to get results for patients. And you know what? The right patient with the right treatment option gives the right outcome. And so that conversation can be had, it needs to be had, but also being very realistic and practical. You know, this is not a miracle drug or miracle treatment solution. You just have to be very understanding that sometimes your results and your perspective on what the results is are different. So today, more and more patients have options to have even a better body after GLP-1. And the goal simply isn't just to look skinnier, it's to be stronger, is to be more confident and fully present in your own skin and living your best life literally. And until next time, I want you guys to stay polished.
I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, new episode drop every Wednesday, so stay tuned. Please like, share, follow.